The Confidence Doc podcast is brought to you by My Evergreen Med Spa. Located in Houston in the Woodlands, My Evergreen Med Spa brings to you the latest aesthetic treatments in the most luxurious environment. Remember, My Evergreen Med Spa, it's me time elevated. Welcome to the Confidence Doc podcast. I'm Dr. Rednam, and I'm a board-certified plastic surgeon in Houston, Texas, also known as the Confidence Doc. And today we have a very interesting guest who's going to talk about something that you are probably seeing in the news a lot right now, and that's hyperbaric oxygen therapy. So please welcome to the show, Chris Neal, the CEO of MD Hyperbaric.
Thank you, Dr. Rednam. It's wonderful to be here and to be speaking with you.
Thank you so much for coming, Chris. I am excited to dive into this topic because it is something that has actually been around for a long time, but it's something that we are seeing a lot more in the news. Would you be able to tell our listeners just a little bit about what exactly hyperbaric oxygen therapy is?
Yeah, so hyperbaric oxygen therapy, as you mentioned, has been around for a very long time. Its origins are actually traced back to 1600s, if you can believe it. It really uses core mechanisms and elements from just nature, including pressure and oxygen. And so the way hyperbaric oxygen therapy works is really in the name. Hyperbaric means increased pressure, and oxygen is obviously the oxygen component of it. So typically what you'll experience is you're laying down in a chamber or seated in a larger room where the pressure within that environment is increased, usually double the normal atmospheric pressure of the earth, and then you're breathing in 100% oxygen. And that has a whole host of benefits, which we'll talk about in a little bit.
And for anyone, our listeners, right, we have people who are doctors, we have people who are potential future patients. Let's talk a little bit about the physiology of this. So on the basic science level, when we breathe oxygen, it's delivered to our tissues. It comes through our red blood cells, right? But our red blood cells each only have so much capacity to get to those tissues. And that's where hyperbaric oxygen steps in. And you mentioned that, it's 100% oxygen. So how is that, if our red blood cells can only hold so much oxygen, how does having a higher percentage of oxygen do anything?
Yeah, that's a great question. And it comes down to, not to get too technical, but it comes down to certain gas laws, like Boyle's gas law. And really, there's a couple of different explanations as to how pressure is a really important element to the body's absorption of additional oxygen. In summary, when oxygen molecule or any sort of gas is applied under pressure, that increases the ability for that gas to be absorbed into the bloodstream or into red blood cells. It also, constricts the size of that gas, which allows for increased absorption as well. And then that proliferation of oxygen throughout the body and through the red blood cells has a number of benefits, including wound healing.
And to make it even simpler for everyone, I always think of it as the plasma. We have our red blood cells that travel through the plasma. Well, with hyperbaric oxygen, that plasma is now getting saturated with oxygen as well. And so areas that maybe don't have as good perfusion, right? Vascularity is not as great, are now able to get oxygen that weren't before. You mentioned hyperbaric oxygen therapy. It's been around a long time. I love a little bit of history. So we let our listeners know, what was the original indication for it?
Yeah, hyperbaric had originally been used long ago for a couple of different key conditions within healthcare. And, that includes not only wound care, but oftentimes it was used for decompression sickness with diving. So anybody who has gone scuba diving before knows that there's very strict requirements on the rate at which you can ascend from deep pressures. The same principles apply with hyperbaric, and actually hyperbaric ends up being a solution for individuals who may have been suffering from decompression sickness. But wound care, traditional non-healing wounds, is another really prominent original indication of use. And then over the last 50 years, there's been roughly 14 indications that have been approved for use by the FDA. And in the last 25 years, there's been a proliferation of additional research into off-label indications that's showing quite a bit of promise.
And I think the really cool thing about hyperbaric oxygen therapy is it really is just utilizing what our body naturally does, right? We utilize oxygen as essential to our well-being. We get oxygen through water, we get oxygen through our red blood cells. So we basically are just taking how we normally heal and we're enhancing it at the simplest form.
That's correct. You're hyperoxygenating parts of the body, especially that could be hypoxic, based on a number of different situations that could be happening in the body, either a wound or an injury, or just the obstruction of blood flow to a normal healing process. And through the hyperbaric oxygen therapy treatment protocols, not only are you increasing hyperoxygenation within the red blood cells and blood delivery, but you're also creating quite a number of knock-on benefits with neovascularization, stem cell proliferation, collagen production, which then creates additional benefits for the body.
Let me start with this. So I know as a physician, one of my biggest challenges has been sometimes when I do have a patient who needs this. I'm a plastic surgeon. I deal with wounds all the time. I do reconstruction. I have a lot of patients who have radiation. That there are times when I've really wanted to get somebody into hyperbaric oxygen therapy, but it's actually been a pretty big challenge. A lot of people don't know, but access to this is kind of difficult.
Yes. Traditionally, the marketplace where you'll find hyperbaric is in the hospital setting or wound care setting. And as I mentioned, there's 14 FDA-approved indications today, which can range from crush injuries, non-healing wounds, as what you're describing, even diabetic foot ulcers, gas gangrene, carbon monoxide poisoning, right? It's quite a spectrum, but they're all pretty critical care conditions. And what we found, though, unfortunately, is that hyperbaric's often been treated as the last line of defense. And so pre-authorizations for things like non-healing wounds requires a whole lineup of documentation, including for non-healing wounds, 30 days of proof of, refractory response to other traditional wound care methods. And unfortunately, that 30 days is a really critical healing window where hyperbaric can be doing some great work. And so access has been quite limited. In addition to, not every market has a hyperbaric center or hyperbaric chamber.
And I mean, I practice in Houston, and if I'm having challenges in Houston, I can't even imagine what it's like in smaller places.
Yeah.
I mean, it's insane. It's really insanity to me. I can say though that what you're talking about, that early time period, there's not a single doctor or surgeon who'd be listening to this who wouldn't agree that the earlier you can intervene, the better. And if you're not getting blood flow, then you're basically saying, let's lose some more tissue before we try to intervene. And that's just not right for patients.
Exactly. And that's actually part of the origin story of MD Hyperbaric, where our founder is an orthopedic surgeon who treats foot and ankle patients. And, when he's doing surgeries, he sees not only the prophylactic benefits of hyperoxygenating a wound or a surgical site, but he similarly had some patients who really could have benefited from this, but he was unable to get them into the hospital setting. And he really took it upon himself to do quite a bit of research into it and try to, make, strides to create more access to hyperbaric oxygen therapy.
So, Chris, I actually had a patient call us the other day and say, hey, could you tell me, do you recommend mild hyperbaric oxygen therapy? Can you comment on that? Because you'll see a lot of things out there that say, oh, you can get a mild or a gentle hyperbaric oxygen therapy.
This is a really important point that I think is appropriate for us to address with your listeners. Hyperbaric is really just, as I mentioned before, increased pressure above normal atmospheric pressure. There's been a segregation within the industry where there's this formation of mild hyperbaric, which is commonly 1.3 atmospheres or below, and then medical grade hyperbaric, which is greater than 1.4 atmospheres. Mild hyperbaric you'll find in a kind of a wellness spa setting or med spa setting. Medical grade, traditionally found in the hospital or wound care. There is potentially some benefit with mild hyperbaric, but the research is far inferior to what we see with medical grade. The majority of research around the benefits of hyperbaric oxygen therapy are environments where we see 1.5 atmosphere or above. Traditional treatment ranges with pressure are between 2 and 2.4 atmospheres, depending on the condition. this is where it's really important to have a provider who's well educated in hyperbaric oxygen therapy, and they can really determine a best course of treatment. But most of the data, just to reiterate, is between 1.5 and 2.5 atmospheres, generally speaking, with all the benefits been shown between those ranges.
And I 100% agree with you, Chris. I knew the answer to that, but I wanted you to talk on it, right? And the thing is, there is benefit, right? We can't say that there isn't some benefit, but you're
That's
right.
right.
All the studies, when we were going in for the purpose of treating serious conditions due to surgical healing, wound healing, any of those things that are FDA approved, those studies are done at that higher atmosphere, not at the I should say temperature, but not at the milder settings. Now, we
That's
don't know
correct.
because and we don't know, right? We don't know for wellness purposes if, I assume that there is some benefit there. But again, if we really want to maximize the benefit, why do it part of the way?
And the other thing I would say on this is two things. One, the absence of evidence is not the evidence of absence. We don't really know that this is, how effective it could be. We certainly have many testimonials out there that mild hyperbaric has been, one, the only treatment option that someone can get access to. Unfortunately, that's their only option, and they have seen some benefit from it. But two, most commonly, and this is kind of another component of hyperbaric oxygen therapy that I mentioned before, is the oxygen part. Most commonly, mild hyperbaric is paired with less than 100% oxygen. It's using oxygen concentrators, which don't have the same purity. The purity is suspect anywhere between 80 to 90% pure oxygen. And again, that's just an inferior version of 100% oxygen at therapeutic pressures. So those are all things to consider when we're evaluating efficacy of the protocol.
And one of the things when you and I first met that really interested me in MD Hyperbaric was the fact that it is, again, a true hyperbaric chamber, but also that you have a physician who's actually doing your evaluation. So some of these places that are having mild hyperbarics, well, they can't traditionally actually have a real hyperbaric chamber because they don't have the proper supervision to be able to administer that type of treatment.
Yeah, there's quite a bit of training and credentialing that needs to go into the process for a hyperbaric physician to oversee care. There's not only a specific protocol that needs to be based on the research that's been published, but there's also a number of considerations for a patient if they're the right fit and right candidate for hyperbaric oxygen therapy, which we can talk about. There's some relative contraindications to be aware of. There's some absolute contraindications like pneumothorax to be aware of, but also just the frequency and ultimately the compliance with protocol is where patients will see benefit, and a trained physician is going to be the key in delivering an effective protocol.
And remember, it's oxygen. I understand we think of oxygen as something that's, very benign, but when you're pressurizing it, it's a whole different game. And so it is extremely important, like everything that is medical, that you have the proper trained people to administer it to you.
And it's a prescriptive drug, as determined by the federal government. It's a prescriptive drug. It requires a licensed physician to write a prescription for. And again, you want that individual to really be trained and understand hyperbaric medicine.
So let's talk a little bit more about some of the common indications for hyperbaric oxygen therapy that you mentioned before.
Specifically the on-label or what types of?
Yeah, let's talk about on-label, and then we can touch on like a lot of the off-label things that are out there.
Yeah. So the on-label conditions, again, the FDA has approved 14 indications of use. I mentioned a couple of them before, but just to reiterate, gas gangrene, crush injuries, carbon monoxide poisoning. Most common is burns and wounds, non-healing wounds and burns. There's just, if you think about the mechanisms of hyperbaric, as we mentioned before, a number of those conditions, especially in wound care and burns, are suffering from hypoxia, right? And just needing to deliver additional oxygen to these wound sites. And so that's where the core mechanism of hyperbaric has really been advantageous for these types of conditions. And again, over the last 25 years, they've started to notice that these mechanisms are starting to form, benefit for other areas of human health, including head injuries, and they're basically wounds of the brain. And there's some prominent researchers who have done some excellent research on the emerging use of hyperbaric oxygen therapy for things like concussions and traumatic brain injuries, PTSD, and other neurodevelopmental or neurodegenerative conditions.
Chris, when someone has a treatment, how long do the effects of that pressurized oxygen last?
It really depends on the types of condition and ultimately if they're going to complete their course of treatment. This is something I would really stress for the listeners and for any patient who's considering hyperbaric oxygen therapy. It is a commitment, right? It's a behavioral change for a period of time. It's episodic care, right? So you're going to undergo a protocol anywhere from, on the low end, 5 sessions for maybe a prophylactic wound healing, just in improving the outcomes of healing, all the way up to 60 sessions for a chronic condition or a traumatic brain injury or a non-healing wound. But we see lasting effect when someone's completing that protocol. Even, we can get into some of the research on it, but even specifically on head injuries, to stick with that, we see neuroplasticity changes within the brain after 40 sessions. And those can have lasting effects. And so this is not necessarily something that a patient would have to do forever. If they can complete their course of treatment and really commit during that period of time, they should see, in most cases, lasting effect, depending on the condition that they're coming in for.
And I think we're starting to also see the value from a surgical standpoint of sometimes pre-oxygenating. You may have heard of people talking about this on social media that, hey, I'm having surgery, but I'm actually getting my hyperbarics the day before. And that's because we are experimenting a lot with, okay, what are the benefits if we know we're going to disrupt blood supply, which most plastic surgery does that temporarily. Well, what if we supercharge those tissues beforehand?
Yep. Yeah, we've seen preconditioning, a very standard kind of a surgical protocol is 2 or 3 sessions before your surgery and 2 or 3 sessions afterwards with, evaluation of the progress of healing. But we've seen, there's studies that have been published looking at exactly this type of protocol that have noticed a marked decrease in bruising and scarring, and, just an advancement in healing time. And so there's quite a bit of, opportunity for an acceleration of healing with potentially better outcomes when integrating hyperbaric oxygen therapy right around that surgery.
I know I'm personally just really excited because, like I said, plastic surgery, we're all about blood supply. And, we're always fighting to get the best results, but working within someone's blood supply. So this to me is going to allow me to get better scars, better, reduced wound healing time and reduce complications overall. And again, it's simple, but it's just something that hasn't been widely available before.
It hasn't. And again, if you think about the origins, this isn't like a pharma industry, right? We're talking about oxygen here. And typically awareness in the U.S. healthcare system is propagated a lot of times by potential pharma, involvement, and they're spending quite a lot of money on marketing and educating the physician audiences as well as the patient audiences. And, hyperbaric oxygen therapy doesn't exactly have that same representation, although there are many organizations out there who are doing great work to educate. It's not quite represented in the same way, even in the medical, education system, as well as to consumers alike. I think it's starting to really get a lot of awareness and positive light. And, there's some great health ambassadors, there's great patient testimonials, and there's physicians like yourself who are really taking the time to understand, is this a potentially beneficial therapy for my patients where they can experience better and differentiated outcomes.
And I think it's like a lot of things where there's home versions. I bring up red light therapy, right? Red light therapy can be very effective. But there's like a million different models. And I'm in all these Facebook groups, like mom's Facebook groups. So, I'm getting my own hyperbaric chamber at home. And I'm like, that's awesome. But just to be clear, there's no way to get this level of hyperbarics in a home chamber because it wouldn't be legally allowed to be sold that way.
And one other thing to just add is, a furthering of this point, not all chambers are created equal, not even just in pressure, right? We talked about the distinction between mild and medical grade hyperbaric, but additionally in the chamber construction and quality, just to get technical for a second, there's really only about 4 monoplace, which is single person manufactured chambers that are cleared by the FDA. This is a class 2 medical device, right? You want to use a FDA cleared version that's gone through the 510K process. In addition to that, there's a number of different, requirements that are legal requirements for chambers to meet certain construction requirements. I mean, literally they're built to a submarine standard, if you can believe it. And so we want to inform patients and providers alike to choose, correctly when selecting a hyperbaric chamber that's FDA cleared, is certified by the ASME, and there's a number of additional requirements when selecting a hyperbaric oxygen therapy chamber. It's not just pressure, although that's a really important element in selecting a correct chamber.
And that's actually where the term comes from a dive, right? Like we say you're having a treatment, you're going for a dive. It's just what Chris was saying, that you're getting in a submarine. But that brings up my next point, Chris. This freaks people out. There are people that are claustrophobic. There are people that are like, oh my God, you're not getting me in that. What's the experience like with the chambers you guys utilize?
Yeah, so we use one of the more spacious and private monoplace, again, single-person hyperbaric oxygen therapy chambers. There's a number of different styles of chambers. Like I mentioned before, there's multi-place chambers. That's basically the size of a room, and it could be 12 people sitting in there with you. Certain people who are claustrophobic may have a harder time, undergoing the treatment, but with the proper provider and the proper experienced team, they will help you overcome some of those concerns. And we've actually had our founder, Dr. Martin O'Malley, is extremely claustrophobic, and he was able to overcome that and understand really with the proper training and staffing that it's a very safe treatment, and he felt comfortable undergoing it. But yeah, talking about diving, it's a very similar sensation to anybody who's ever gone diving, where you lay in a chamber, it's non-invasive. You're just sitting there in a pressurizing environment, breathing in 100% oxygen. The oxygen is quite relaxing as well, and you can just read, nap, meditate. It's a great removal of all distractions from life, and I find it to be a very serene experience. You're equalizing your ears or clearing your ears, like if you're going up in an airplane or if you're going diving. You're doing that a few times as you're pressurizing. Otherwise, you're laying back and relaxing for about an hour in the chamber while your body is rigorously healing and performing some impressive processes.
So you essentially could just sleep for the whole time.
A lot of people do. Yeah, I'm not a great napper, so personally, I enjoy a nice book, but I find it to be extremely peaceful. And if nothing else, just the time to yourself and having a meditative environment like this is really helpful. For individuals to undergo.
Because I know somebody is absolutely going to ask this, Chris, can you take your iPhone in there while you're diving?
You cannot. No, electronics are prohibited from within the chamber. There's, just to comment on this, one of the important things about a technology, a medical device that's been around for so long, is it's well regulated, right? And that should be a sign of confidence for consumers and physicians alike, is that there's a rule book to follow. There's a well-established guideline of how to operate this very safe therapy in a very safe way. And, electronics are prohibited from within the chamber, as well as, a number of additional requirements to ensure a safe treatment.
And, for anyone who's like, oh man, that's that much time without my device. Remember, 100% oxygen is very flammable. And just like anywhere else that we'd be using oxygen, whether that's in surgery or anywhere else, we obviously want to keep any potential for a spark away from it. So that's why it's so important. But I think it's amazing. If I had an hour where I could actually sit down and be quiet, think of it as a good opportunity for a good rest for your brain,
That's exactly right. Yep. Good way to think about it.
I know that MD Hyperbaric started, strongly on the East Coast. What is the plan for your company? Because there's really nothing like you guys out there right now.
That's correct. We are rapidly expanding because, as we mentioned earlier in this conversation, access is a little bit of an issue for patients. And we've gone into a number of communities already. We're in 9 communities already, opening and operating clinics. And over the next few years, we'll be opening close to 100 clinics across the U.S., partnering with physicians like yourselves, as well as additional, locations we're opening just to service more communities and ensure that we can provide access to those in need.
And I think that's fantastic. Like I said, this has been a challenge that I've had a lot, as have my partners in my practice. And, we want to be able to continue the top quality care we give. And this is a very regulated, safe way to do this.
Yeah, that's correct. Again, there's a whole host of requirements that go into opening one of these. It may seem simple; it's just a chamber, but in order to perform this safely and effectively, there is really quite a number of standards to follow and a lot of research to go into it when you're ever thinking about getting started in hyperbaric oxygen therapy.
And because we always have to consider cost, can you explain a little bit how these treatments are set up for patients who be interested in coming, or if providers are interested in being able to send their patients?
Yeah, it depends on, if it's going to be covered by insurance or if it's off label and going to be need to be out of pocket. If it's covered by insurance, really that's up to, your carrier. Really only those 14 FDA approved indications are going to be covered. We get this question a lot about, can I use my insurance for, this discretionary surgery or for wellness or longevity? And unfortunately, it's very unlikely that you'll be able to get covered for that. So in the event that you're not covered, cash-based procedures are for hyperbaric are on average about $250 per session in an average market. The higher end of that can get closer to $300 to $400. The lower end could be about $200. That's likely going to vary by market, but on average, it's roughly around $250 per session.
And I can tell you, just like from my experience with any of my patients who would have fallen under the insurance coverage, I wasn't able to get them into hospital fast enough. So I think that this is going to be able to open more possibilities for my patients as well as many other patients to be able to get proper, timely treatment.
That is so critical when it comes to, just the continuum of care and ensuring that we're providing, healing and a therapy when it matters most. And so that's certainly a cost benefit to weigh when patients are evaluating their care options.
So I'm very excited for the future of hyperbaric oxygen therapy. I think that, the FDA approvals will probably just increase with more time and more research. But I think that there's no doubt that we're seeing benefit for a variety of things that maybe haven't received their FDA approval so far.
We've seen, again, not only a proliferation of research in a number of different areas of human health, but the testimonials that we even experienced from our staff, from our patients is just pretty unbelievable. And so I'm very excited about where the industry is moving. And, we're excited to see where additional research areas will come out and to solidify even further areas of research that we've already, experienced benefit. And so, the industry is on a really bright path in terms of providing more benefit and more access for more patients.
100%. I think everything is shifting towards more wellness with all of our health, and I like that trend. Prevention is the best thing we can do, and in this case, it's old science, but it's solid science. We're just finding better indications for it.
Yeah, that's sometimes a really nice pairing where you have a technology that's been around for so long, it's been regulated, it's been evaluated, right? There's a marketplace and there's a use case for it, and you find new uses and new spins on it that can provide more access. I mean, that's a nice kind of assembly of variables together that can be a great benefit for patients.
Well, thank you so much, Chris. This has been awesome. Is there anything you would like to leave our listeners with, like your top three things, or just something that you feel like is a very important takeaway from this?
Yeah, I would just leave them with, I would encourage you to do a little bit of research about hyperbaric oxygen therapy. Again, it's a time-tested modality. There's a range of benefits both on and off label with, emerging research coming out every single day. And if you're considering, is hyperbaric oxygen therapy right for me? I encourage you to do some research. Our website, mdhyperbaric.com, has a lot of great information and studies published within the website. And, I just encourage people to learn more about it and see if it's right for them.
And that website's a great resource, whether you are potentially a patient who might be interested in this, or if you're a physician who wants to learn more about incorporating this into your practice, correct?
100%. Yep, both.
Well, awesome. Well, thank you again, Chris, for being on the show. And everyone listening, I really encourage you to do your research. We're all about education here. And as always, I hope you learned something new. So thank you all for listening to this episode of The Confident Doc, and stay tuned for next week.